Our first presenter today is Ms. Danica Binkley. Ms. Binkley is a policy advisor for substance abuse and mental health at the Bureau of Justice Assistance, where she works with national, state, and federal partners in developing court initiatives and implementing demonstration projects involving innovative court and criminal justice system strategies. She develops and shapes national policy focused on enhancing and improving the criminal court system, including continued development of problem-solving courts and problem-solving strategies. Our second presenter today is Ms. Hallie Fader-Tao. Ms. Fader-Tao directs the Justice Center's projects involving court-based programs and practitioners, including providing technical assistance through the Criminal Justice Mental Health Consensus Project and the National Reentry Resource Center. In this capacity, she has worked with jurisdictions across the country, planning, implementing, or expanding court-based strategies to address the needs of individuals with mental illnesses or individuals returning from secure correctional facilities. She also currently manages the development of training materials on the planning and implementation of mental health courts and on judicial responses to the prevalence of individuals with mental illnesses involved in the criminal justice system. She has written on dispute systems designed for state trial courts and has worked on a variety of projects for courts in New York and Massachusetts, including problem-solving programs, strategic planning efforts, and task force on pro se litigants. Our third presenter and moderator of the question and answer section is Alex Blanford. Ms. Blanford works on projects that address the intersection of mental health and criminal justice, including developing training programs, modules, seminars, and more, and providing support to grantees focused on planning and implementing court-based programs to improve responses to individuals with mental illnesses involved in the criminal justice system. Prior to joining the Justice Center, Ms. Blanford was the project coordinator for the Institute for Evaluation, Health Science, and Community Health, housed in the Graduate School of Public Health at the University of Pittsburgh. There, she was involved with a variety of research projects, including one examining the Pittsburgh area's emergency response to mental health crises, and another on the evaluation of the area's crisis intervention team training program for police officers. Our last presenter today is Ms. Brenedy Rice. Ms. Rice is the problem-solving court coordinator for the Colorado Judicial Branch, Division of Planning and Analysis. She has worked with problem-solving courts for over 8 years, assisted in planning and implementing several different courts, with an emphasis on data management for the purposes of ongoing program evaluation, and is a founding member of a nonprofit organization supporting drug courts. In her current role, she is responsible for problem-solving court development, evaluation, training, and technical assistance statewide. She is currently employed by the Colorado Judicial Branch, Division of Planning and Analysis. We are very excited to have Danica, Hallie, Alex, and Brenedy as our presenters this afternoon.
Thank you, Mariana. Our presentation today is in 4 parts. First, Danica and Hallie will introduce the curriculum and tell you more about how it was developed. Second, I will give you a tour of the website and show you the curriculum's different components. Third, Brenedy will talk about her experience piloting the curriculum in Colorado and share some of the lessons learned. Last, we will answer as many questions as possible, and as Mariana said, if you could please put those into your chat box on the right-hand side of your screen. We'd now like to conduct a quick poll to get a sense of what experience our audience members have working in or with mental health courts. So please take a moment to answer the question that will appear on the right-hand side of your screen. And we will share the results in a minute or so. Thank you so much for all of your responses. We're just going to tally the results here, and I will share with you the results. Great. So we have the answers to the poll here, and it looks like, just opening up the percentages, 14% of our audience works with an existing mental health court program. 6% works with a new mental health court program that's less than a year in operation. 32% of you do not work in a mental health court, but you're interested in learning more about them. And 22% of you also do not work in a mental health court, but you work in another type of collaboration between criminal justice and mental health. And other 8%, and we had 18% who didn't participate. But thank you so much for your results. Really do appreciate that. Great. So now what I'd like to do is I will turn it over to Danica so she can welcome you all.
Wonderful. Thank you so much. As stated at the beginning, my name is Danica Binkley. Some of you may know me as Danica Zarvis Kid. I was recently married and have a new last name. I oversee the Justice and Mental Health Collaboration Program for those of you who are grantees or who may have applied through BJA's Justice and Mental Health Collaboration Program. And I do oversee all of our mental health efforts at BJA. I have to say this is a very exciting moment for me. I have been with this project since its inception and have watched the mental health court curriculum develop and evolve over the past couple of years, and the end result is better than any of us at BJA could have expected. We are so excited and thrilled and impressed with this final product that you'll learn more about today. So that said, I'm going to give you a little bit of background about mental health courts. And what we know about them. The number of mental health courts has increased dramatically over the past few decades. In the 1990s, there were only a few in the country, and now there are over 300 jurisdictions in almost every state that have launched mental health courts. As judicial, county, and state leaders, as well as advocates, look to create or expand mental health courts in their communities, there has been a steady increase in the number of those from both the criminal justice and mental health systems seeking to make sure programs are designed, implemented, or enhanced to achieve positive public safety and public health outcomes. The Justice Center, in partnership with the National Center for State Courts, surveyed state court administrators across the country, and their responses illustrated this need. The survey revealed that only half of the 23 responding states and one territory had some training for problem-solving courts, and almost all of the states without some problem-solving court training expressed interest in the mental health court curriculum. Despite this need, communities face limitations in their capacity to create new training materials or travel to attend training events. Until now, there has been no single widely accessible resource to guide interdisciplinary mental health court teams through their program design and implementation process. The curriculum uses the blended learning model, which combines free, accessible online content with numerous ideas for face-to-face group activities to facilitate team building. It meets participants where they are. BJA has a history of supporting the creation and enhancement of programs and development of materials on this topic. BJA's Justice and Mental Health Collaboration Program supports programs working at the intersection of mental health and criminal justice. Since its inception in 2006, JMHCP has funded 94 court-based programs out of 255 total. BJA has also commissioned the Justice Center to create a suite of materials on mental health courts, including those that will be highlighted at the end of today's presentation. We're very excited to share this new resource with you today, and I encourage you to reach out to me if you have any questions about BJA or the resources that we can provide. Thank you so much.
Great. Thank you, Danica. This is Hallie. I'm pleased to really be representing the Justice Center team that's been leading the effort to create this curriculum. As Danica said, it's been an effort of a couple of years, and we are really excited to be here today sharing this with you. I wanted to talk a little bit about how the curriculum came together. I know the history of a product is most interesting often to the people who are involved with it, but I think it's some important context for you all to have in terms of understanding what's included in the curriculum, as well as the different ways that we've set it up to make it, we hope, as accessible as possible. We're also really proud of the collaborative effort that came together to develop this, and we'd like you to see the different perspectives that came together to inform the content that you'll see within the curriculum. As Danica said, when we started this project, we knew that there were several hundred mental health courts in the country, several thousand drug courts, but that the mental health courts around the country were in many ways doing different things, using different standards, focusing on different problems, different target populations. We also knew that while the research base explaining when mental health courts work to increase public safety or improve public health, while this research base is growing, it is not extensive. It's a relatively new program model and hasn't been studied quite as much as it could be. So one of the challenges in developing this curriculum was harnessing the national knowledge, whether it was research or the experience of practitioners, and capturing that in a form that would be accessible. Another aspect of the development was understanding the training needs of states. Some states have very extensive and well-developed training for problem-solving courts. Others have very little. And so we wanted to create a product that would be helpful for those who already had a lot in place as a supplement, but would also be comprehensive for those who really would be using this as their sole resource to understand what a mental health court is, decide whether it's the right thing for them, put it up in place. The final challenge or factor in the development of the curriculum was that from the beginning we were not picturing the development of a training institute. So that we were not setting up a series of annual conferences or a series of annual meetings. We wanted to create a resource that would be available for different types of policymakers and practitioners where they are, and would be able to stand on its own to be helpful for those, so it would be directly accessible. So how did we do that? Well, we got a lot of friends together. What I'm showing you right now is the steering committee that guided the work of the project. You'll see really wonderful partnership among different national organizations representing the courts, representing behavioral health community, different constituencies who are involved in operating mental health courts, prosecutors, defense attorneys, judges, treatment providers, probation. We really tried to have input from the policy folks, the folks who were doing the research, and the folks who are on the ground really trying to make this happen. You'll see we were lucky to have practitioners from several states and local jurisdictions as well involved in the development of the curriculum. I also wanted to point out the Center for Social Innovation, who are our partners in the educational design of the curriculum. So they were the ones who were giving input on the latest research in adult learning as well as in online learning, so that the way the curriculum was developed is, we hope, in line with the best thinking about how professionals learn, the time that y'all have to devote to learning and how you're most likely to get the information that you need to do your jobs. Our steering committee was convened in January of 2011 and helped us think about the audience for the curriculum, the content that should be included, how the curriculum would be formatted, as well as identifying for us key resources that should be included. We really wanted this curriculum to include the best of what's out there, instead of creating a second version of something that's already been created. in order to, with this guidance from the steering committee, we worked to develop a content outline, to develop the drafting for the curriculum itself, and then we did a lot of test driving, and I'm going to tell you a little bit about that, bringing in perspectives from practitioners to tell us if the scenarios we described were realistic, checking with researchers to make sure that we had been as precise as possible about the findings from their studies, as well as the folks who do this training to explain, to think about, what is a doable length for a module, what sorts of activities have you seen succeed with interdisciplinary teams. In terms of the test driving, we did this in two ways. We had a pilot process where 2 states and 2 local jurisdictions were selected through an application process to test drive the curriculum for us. Through this process, Colorado and Delaware were selected at the state level, and Jefferson County, Washington, and Polk County, Iowa were selected at the local level. We wanted to select pilot sites that would be representative of the target audience for the curriculum. So we were looking for sites that had diverse geographies, size, population density, as well as sites that had different levels of experience with mental health courts. We wanted some places that felt like they already knew as much as they needed to know about mental health courts, but wanted a little bit of a tune-up. We wanted some places that were exploring the concept for the first time. Alex will talk a little. The other part of the piloting process included work with state-level trainers. So we convened state problem-solving court coordinators from 7 states, which are highlighted in orange, to review the full curriculum and get input on opportunities to improve it, including how they would see themselves using this curriculum in training. And we appreciate their contribution so much towards the development of some of the materials you'll see that focus on coordinating delivery of the curriculum and then facilitating some of the curriculum's group activities. This is a photo from some of the pilot sites. For the pilot sites, those who participated included the sort of interdisciplinary teams that are most often trying to start a mental health court. So in the local sites, these were judges, probation officers, court administrators, prosecutors, defense attorneys, mental health agency administrators, mental health and substance abuse treatment providers, representatives from local chapters of the National Alliance on Mental Illnesses, and others. Each of the pilot sites had their use of the curriculum facilitated. The local sites selected one of their own team members who sort of led the training effort. At the state level, state trainers and problem-solving court coordinators were involved with delivering the training, and you'll hear more from Brennedy about the experience in Colorado delivering the training. So what does the curriculum include? What have we been talking about? What I'm showing you here is a list of the different content areas that are included in the curriculum. These are the curriculums. This is a snapshot of 6 of the curriculum's key modules. Understanding mental health courts is our introduction. It includes information about research on mental health outcomes and is designed to help a jurisdiction decide whether or not a mental health court is something that they want to do that makes sense for their site. Module 2, Your Community, Your Mental Health Court, talks about customizing a mental health court based on local priorities and resources. The mental health court team in Module 3 focuses on team dynamics. Module 4, Target Population, is about designing a mental health referral process and selecting who is most likely to benefit from your program based on research and based on national research and the resources that you have in your available to provide to your program participants. Module 5, Designing Policies and Procedures for Program Participation, is about the nuts and bolts of what goes into somebody's participation in mental health court, ensuring that your program's policies and procedures take into account relevant federal and state laws, protect individual privacy and due process, and incorporate some of what programs around the country have seen works well in guiding participants through the process of program participation. Module 6 is about case planning. Module 7, which I know you can't see here, is called Facilitating the Success of Mental Health Court Participants. This is sort of often called incentives and sanctions, but the idea of this module is what can you set up in the design of your program and in the actions of team members in order to encourage participants to adhere to their treatment plans, comply with conditions of supervision. What can you do to make it more likely, based on the available research, to have your participants be a success? The final module, Module 8, is called Launching and Sustaining Your Program, and that's more about the nuts and bolts of program management and funding questions. In addition to these 8 core modules, the curriculum has 2 introductory modules. One is Introduction to Criminal Justice, that focuses on the basics of the criminal justice system. It includes interviews with individuals who are in each of the classic mental health court roles, so a defense attorney talking about what he does, a prosecutor talking about what she does. And the goal of that introductory lesson is really to acquaint partners on the mental health court team who don't know quite as much about criminal justice processes with the nuts and bolts of what they need to know in order to participate on an interdisciplinary team. The second introductory module flips that, so we have an introduction to behavioral health, and that's targeted at criminal justice professionals. So it includes basics about mental illnesses, what we know about available treatment, and the sorts of treatment providers they're likely to encounter as they partner with behavioral health to develop this sort of program. So in total, the content of the curriculum includes 8 modules that are an A to Z of what you need to know in order to decide whether a mental health court makes sense for you, set one up, operate it, manage it, and sustain it, as well as 2 introductory modules that can be used either to ensure a common level of knowledge from practitioners from both systems, from criminal justice and behavioral health. It's also something that we thought folks might be interested in as a cross-training opportunity. Maybe your jurisdiction, the judge would like to teach Introduction to Criminal Justice to the treatment providers, and the head of the mental health agency would like to teach Introduction to Behavioral Health to the judge and the attorneys. We wanted these to be available to hit those different areas of content. Within each of those areas, within each of those modules, there are a couple of different types of resources. So we're looking right now at the components of Module 2. Each module includes prep work, which are background readings that introduce the content that's going to be described in the module. A presentation. This is a self-paced series of slides that include readings, video interviews, audio recordings that introduce the key concepts for the content area. So at the end of that presentation, a learner would have a basic understanding of that content area. We anticipate that those presentations will take about 30 minutes to complete. There's a short quiz at the end that helps you measure whether or not you've picked up the key content that was included in the presentation. Each module also has an activity guide, and the activities are the parts of the curriculum that you can do live with your team to help apply the content that you saw in the presentation or in your reading to the actual design and operation of a mental health court. Activities include exercises that help new teams determine what their target population should be based on what they learned in the presentation, or that guide teams through a process of seeing how a hypothetical county has addressed a different mental health court issue and decide whether or not that was in line with the best available research and practice. One of the really exciting, one of the elements in the activities guides that we're really excited about is the inclusion of a video case study where we have a real mental health court team acting out different common situations, whether it's accepting program participants, doing a case conference based on participant behavior, or responding to an emergency involving one of the participants. And so you can see the team interacting in that way, and there are facilitated discussion questions to help your team figure out whether that's the way you would have handled it or another way. Huge thanks to the team in Bonneville County, Idaho, for being our actors and for this case study. In some cases, we asked them to play a role that might not have been how they'd handle it themselves for educational purposes, but in a lot of ways they were just themselves, and they were really wonderful in sharing their experiences. The final component of each module is a list of additional resources, and this is a way for you to learn more. So this is where we have collected links and PDFs of program examples from around the country, connecting you to partner organizations, to research, so that if you want to go deeper in your learning on certain topics, you have a curated list of leads to pursue. Who's it for? Well, we hope it's going to be for everybody. No, the idea of the curriculum was really to make it as flexible as possible, both in terms of the content that's included as well as the types of activities that are included. So we worked with our advisors to really make this as adaptable as possible. If you're a brand new team thinking about starting a mental health court, we hope this is going to be an A to Z that gets you started in a positive direction. If you already have training on certain areas and are just hoping to supplement that training, you can target which content you want to focus on, or target the activities that you think address the needs that you're encountering. The curriculum is also available as a resource to get new team members up to speed. So if there's somebody new joining your team, this is a primer on what a mental health court is and how they might see this new role that they're coming into. We also tried to, wherever possible, infuse general principles about criminal justice and behavioral health collaboration in these materials. So a lot of while the materials are targeted at mental health courts, they have a lot of broader applications. The module on program management and sustainability, while it's focused on mental health courts, includes information that's relevant for anyone trying to manage or sustain a program like this. Similarly, the module on target population includes research on criminogenic risks and needs, assessing behavioral health needs that's relevant for any collaborative that's working on addressing the needs of individuals with mental illnesses involved in the criminal justice system. So we really hope that this will be a rich resource that is available for diverse audiences. I hope I'm sure you can tell how excited I am about this and proud of it. I am. And here it is. Here is the web address if you would like to access the curriculum. And I will be turning it over to Alex to show you around.
Great. Thank you so much, Hallie. So it's my pleasure to now give you a tour of the curriculum website and show you the different components. Obviously, you have the link there in front of you, so I hope that you will continue to poke around on your own. But I just wanted to show you a few things specifically, just to make sure that you're familiar with all the different components and what the curriculum offers. So here we are here. There we go. Sorry about that. So here is the curriculum homepage. This is where you land when you first visit the curriculum. So when you put that URL into your internet browser, this is where you will land. I'd like you to notice the top bar there in sort of a beige color. That is navigation to different areas on the Justice Center's website, such as publications, news, announcements. And the navigation bar below that in the maroon color, which I will talk about in a moment and zoom in a little bit so you can read. I understand that, the font there is a little bit small. That is the curriculum's navigation bar, and we'll talk a little bit more about that in a moment. On the right-hand side of the screen, there is a link to key information for everyone who is visiting the curriculum, and we really do encourage that everyone who visits the curriculum clicks here and reads this information first. Below that, there are links to all the learning modules that Hallie referenced earlier, and the idea there is that for returning users that you could quickly access a particular module that you've been working on and that maybe you're coming back to, and you can just access that very easily on the homepage. And next to that, in that box with that photo there, Curriculum in Action, that is a feature that is coming soon, and it will include news, announcements, features about the curriculum, and testimonials, and just information on how people around the country are using it. And I'm going to plead for you all to send us some information and pictures of you using it and testimonials later in the presentation. So now let's take a closer look at the curriculum navigation bar on the next slide. So the curriculum navigation bar includes Curriculum Home, which means that, all websites that you can return to the home page from any page that you're on. The About tab, that takes you to information about the curriculum, including more detail about the development of the curriculum and the acknowledgments. Using the curriculum takes you to a user's guide, as I mentioned, that we would like everyone to read first. It just tells you how to use the curriculum and how to get the most out of it. It also contains information for those who are coordinating a group to go through the curriculum or facilitating a group through the curriculum, which you'll hear more about Brenity's experience doing that later on. Learning modules, that takes you to a list, as you saw before that Hallie showed you, of all of the modules. So the 2 introductory lessons that she mentioned on criminal justice and on behavioral health, and also the 8 modules that she listed. And they have descriptions, and you can access them there very easily. FAQ, that is frequently asked questions about the curriculum, and contact us, very self-explanatory. That's where you can contact us for help or with questions. So now that we've explored the home page, let's get into the thing. Let's enter it. So, as I mentioned, and I'm sorry to belabor this, but I really do encourage you to click here first. Key information for all users. It gives you information you need, whether you're using it on your own or with a group, or as I mentioned, if you're a coordinator or facilitator. So everyone will find the information, hopefully, that you're looking for there. And if you're not, let us know. Next, you can access the user guide here on this page, as I said. And there's also a PDF version, which you can access by clicking on that link there. And that brings up the user guide. And this contains the kind of the nuts and bolts, the technical requirements that you need, an overview of all of the different components, And you can print this out very easily or read it as a PDF on a device or on your computer. Here, I'd like to go back now just for a second to the Using the Curriculum page. If you notice in the right-hand side there on the in the sidebar, there is information that was specifically designed or written for those who are arranging the use of the curriculum by a group. So we call that coordinating the delivery of the curriculum. And there's also, below that, information for those who are facilitating a group or leading a group through the curriculum. We'll talk a little bit more about that in a moment. But let's look at the information for coordinators first, which you can access by clicking on Learn More, which the red arrow is pointing to. And you land on this page. And as before with the user guide, there's a PDF document is available as a PDF, so you just click on that link there where the arrow is pointing, and it pulls up the resource. And what this resource contains, as you can see on the screen, is helpful information for those who are bringing together a group, including how to choose a facilitator or trainer, how to decide on a schedule for completing the curriculum. We get a lot of questions about that, and especially from our pilot sites, it's very interesting. We learned that it's designed to be adaptable, and coming up with a schedule that works for you is something that we have information on in this guide to help you figure out how to structure the schedule for the curriculum. The next bullet there, convening the group to participate. So who should I invite, how to get the word out, and how to bring the group together. And the next bullet there was another piece of information that our pilot sites recommended was collecting data to inform the discussion. So what can you collect ahead of time from people coming to the session that you will have on hand that will make your conversations even richer? So what are things that, kind of like a needs assessment, what are these things that we can ascertain ahead of time to really figure out what we know and what we don't know and what we want to know more about? So now let's take a look at the resource I mentioned before for facilitators, or those who are leading a group through the curriculum. We can access it here by clicking on the Learn More link. And also, we can also access it from the Using the Curriculum page, which we were on before. It will be in the same right-hand side in the sidebar. So we'll click on that link, and we'll come to the Facilitating the Delivery of the Curriculum page. And as we did with the last resource, click on the link, and it'll pull up the PDF. And this resource contains tips for those for facilitators, drawing on a lot of input from experienced trainers and program planners. As I mentioned before, we got a lot of information from our pilot sites and also from our steering committee members and from people who are experienced and have led trainings with mental health court teams, and what do they recommend and what are their tips and tricks. And we tried to incorporate all of that information into this resource. So there's advice on preparing for and leading the use of the curriculum, suggestions for materials, so down to the most basic things like what kind of materials do you need on hand, like an easel and things like that. But it's kind of like a checklist that we included just to help you organize your thoughts and how to bring the group together and to have a successful session. We also have tips on creating an optimal learning environment. So what are strategies that you can use if, there's some dynamics in the group that are difficult, or what if, there are individuals in the group who aren't talking much and the conversation's a little stagnant. So what are some tips and tricks that you can use to get the conversation going again? So now that we've looked at those resources, let's visit the About the Curriculum page. Unfortunately, I'm unable to scroll down, as this is a screenshot, to show you all the information, but there are links in the sidebar on the right-hand side there that you can see what exactly this page contains. And there's information about the curriculum's content, its components, again, some information about what the user guide is, what those resources are that I just showed you. And there's also links to the acknowledgments And as Hallie said, there were a lot of people involved in this project and a lot of people that we wanted to thank. And please take a look at the acknowledgments just to see the scope and breadth of experience and from across the country of people that were engaged in this project. It's really, really impressive. And if some of you are on the line today, we just really appreciate all of your help. Also, you can access here the methodology document, which provides additional details on some of the information that Hallie went through. And if you're particularly interested in the learning approach that we took, there's a lot of information in there that is very, very, very interesting on that subject. Next, let's look at the learning modules. So we'll access them from the navigation bar there. And it will pull up a page that looks like this that Hallie showed you. Unfortunately, with it being a screenshot, it doesn't capture all of the modules in a way that you can read the titles. But if you go on the website itself, you can see a list here of all of the modules. And as you put your cursor over each one, you can show a description of each of the modules. And to access one of them, you would just click anywhere within that box. So let's do that. Why don't we go into Module 4? Let's take a closer look at that one. So here we are in Module 4, Target Population. This is the module homepage. And you'll notice that there is a description of the module at the top, and there's the learning objectives stated there. And those are also included in the presentation. And there are a list of all the different components of the module that Hallie went over before. And we'll talk about each one of those individually so you can get a sense of what those look like. And actually, I do have another slide just to show you the rest of them here. So if you were to scroll down on the page, here are all the components that you would see. So next, let's go through each one. Let's start with prep work. So the prep work page for each module, as you can see here, coming into it, it contains a list of readings and resources that, as prep work implies, that you would do to prepare for going through the rest of the module. So you would do these things first. Everything is available by clicking on the link, and it'll come up. Everything's in the website itself and accessible. It'll probably come up as a PDF, or perhaps it's a website. And some of these materials were written specifically for the curriculum, and so they are new resources, and others are existing resources on that particular subject that we felt were, or we collectively felt that they were most relevant to read to really prime you for the rest of the module to get the most out of it. So now that you have read the prep work, let's go to one of the presentations. So we'll go back to that page that we saw before, which is module homepage, and click on the presentation icon. And you can, here we are. This is what one of the presentations looks like. I apologize for the small font there, but if you were looking at it on your screen on the website itself, Hallie mentioned before that they were self-paced modules. And as you can see here, there are a series of controls and the blue bar at the bottom and navigation bar that enable you to move forward and back as you would like, and a button to go to the beginning. And each module is divided into a number of parts, as you can see here. Target population is divided into 3 parts, or the introduction in part 1 and part 2. And you can move through the presentations or just come back to them and remember what slide you were on, so it's really at your own pace. So now that we've completed a presentation, and maybe perhaps you did it on your own, or perhaps you did it with a group all together, now is quiz time, everyone's favorite time. Quizzes contain 5 questions, and explanations are provided for each of the answers. It'll just tally up your score and let you know how you did. Depending on how it is structured, you can just go through the quiz just to test your own knowledge, or perhaps as a group you would go through the quiz just to see how you all did. That just depends on the setting. And here is the bottom portion of the quiz, so you can see what some of the questions look like there. Pretty standard true or false, multiple choice options. So now I'd like to show you the activities guides. So each module has an activities guide, and in each of the activities guides there's a series of activities that range from discussion questions to some role playing. And most of them are designed to be completed with a group, but there are some individual portions. And so this is what the activities guide page looks like. And by clicking on that link there where the arrow is, you will download the PDF of the guide. And so each module has a guide this is the cover of the module, activities guide from Module 4. But again, please encourage you to take a look at the activities guides themselves and just to get a sense of what the activities look like, because there are a lot of different types of activities. There are also videos that accompany most of the activities, or most of the activities guides, I should say. There's only one module that doesn't have videos, that's Module 2. You can access the videos right here on the Activities Guide homepage and stream them that way. There's also a link here to a cast list of sorts. So you can keep track of who's who in the video and what their role is. And again, as Hallie said, we'd like to thank the Bonneville County Mental Health Court team for all of their help in creating these case videos. Next, we're going to look at the last component of the module, which is the additional resources. So if you have any additional questions about the topic or something that you'd like to learn more about, we've included a list of policy and practice guides and also a list of websites, which you can't see there, but they might be at the bottom. And this is really just an opportunity to just broaden your learning on the particular topic and to see examples of what other programs have used. So there's examples of different materials, like, for example, a sample policy and procedures manual from a court, or what did a particular court, how did they design their incentives and sanctions, and there are some examples there. So just to give you a sense of what programs around the country are doing, and also some other training resources and some additional primers on various topics. So now I'd like to show you, there's two remaining buttons here on the nav bar. We're almost done with our tour. This is the frequently asked questions page, which you can access there by clicking on the nav bar. And our intention is this will be a dynamic page. We'd like to update it, so please, if you have questions about the curriculum, don't hesitate to send them to us, and we'll do our best to include answers here on this page for you. And finally, the Contact Us page. I keep saying, please, we want to hear from you. This is a great way for you to contact us. Click on this page here, and please tell us if you need help using the curriculum or the website itself, or if you have any questions about how to adapt it in your own community or in your own jurisdiction, please let us know. And also, we ask that you complete our brief online survey, which is loaded into SurveyMonkey, and there's a series of questions that we'd really like to hear about your experience and what you liked best about the curriculum, ideas to enhance it. So we really do hope that you will complete that for us. So that concludes the tour of the website. Again, please visit the website itself, as obviously that's a lot more dynamic than showing a series of web shots. But please just explore and let us know if you have any questions about any of the features on the curriculum as you're moving through. So now I'd like to turn it over to Brennedy, who is going to share her experience using the curriculum and facilitating its delivery with different groups in Colorado, which, as Hallie mentioned, was one of our state-level pilot sites. So, Brennedy, I'm going to turn it over to you.
Great. Thank you, Alex. And again, my name is Brennedy Rice, and I am the State Problem-Solving Court Coordinator in Colorado. And also getting over a cold, so please excuse my voice. So basically, I'm going to just go over kind of some background information about Colorado and then some of our experiences in piloting the curriculum. And first of all, I'm just really pleased to be able to share our experience. It was an incredible learning process for myself, and I think for the team that participated as well, and feel very appreciative for that experience. And so Colorado is our problem-solving courts. Right now, we currently have 72 different problem-solving courts around the state. And our courts have historically been very grassroots. They are created locally with the local jurisdictions and decision makers that have come together and decided we need a problem-solving court to address issues in our community. And so my position with the state has very much been as a resource to provide training, technical assistance, information, to be a liaison to the legislature and to advocate for problem-solving courts. And so our unit for problem-solving courts is a unit of 2, and only just recently has any legislation even recognized problem-solving courts. And in that recognition, it was to provide funding. And so they are not in statute. It is a local decision to start problem-solving courts. And my job is just, again, to provide resources, training, technical assistance. And so it really fit well with our interest in piloting the mental health court curriculum because we, for a couple of different reasons, it was things came together in the timing when we actually applied to be a pilot site, and we learned of this opportunity actually through one of our jurisdictions that we trained. They were interested in starting a mental health court, and they contacted us to ask if we would be interested in piloting it as a state. And so we moved forward, applied, and then were given the opportunity to go forward with the curriculum. And so that is, most of our training is actually from the bottom up in this instance. And so it's been really interesting how that developed, as well as we learned that there was a need for this because of jurisdictions contacting us and saying, we want to start a mental health court. We have some concerns about how people with mental illnesses are, how their outcomes are in our system, and we want to do something to improve it. What can you do to help us? And so this came along at that time where we were getting a lot of questions about that. So it became very obvious that something like this was needed in our state. That, in tandem with having few resources to develop anything like this, it was really, it worked out really well for us. And currently right now, we are developing training standards for our problem-solving courts. And so we are even at a place where we don't have training standards. Most of our training occurs at our annual conference. That is where, and it's not required for all team members, but we certainly ask all team members to attend. So in developing these training standards and having the mental health court curriculum, it actually gave us the resources to set standards and then provide the tools so people can meet those standards in their problem-solving courts. And again, as I said, the local jurisdictions expressed an interest to us, and so it was very much driven from the grassroots on the need for this type of training. And currently, right now, Colorado has 5 operational mental health courts and 4 in planning. And at the time that we developed this, there were 4 operational mental health courts and 5 in planning. And so we've had 1 hit the ground running since we piloted it, and 1 that we trained that had actually just started operations as we were piloting the curriculum with them. So as you can see, we actually trained 4 different jurisdictions, and 2 of them were, actually 3 of them were more in non-urban areas, and we had 1 in a more urban, suburban area. So, and these were communities that were very unique as well, some along the western slope, some more in the plains of Colorado, which come with very different needs and perspectives. And so we reached out to these jurisdictions that had expressed an interest, and they agreed to pilot the curriculum with us. And when we had initially kind of taken a tour of the curriculum and decided how we were going to implement this, we decided that we would try to do all 8 modules, including the 2 introductory modules, in 2 days. And when we did the training, we had 2 teams that came together over 2 days. Typically the training was about a week apart from each other. And we covered all the modules in those 2 days. And I would say some of the feedback that we received was that was just not enough time. There is a tremendous amount of information in the modules. And also, in 2 days, going through all of the 8 modules, you are working through developing an entire program. And because decisions need to be made in the development of that, I would recommend, coming from the state coordinator perspective, that this is an ongoing training curriculum with the jurisdictions. And so in some ways, I think it would have been beneficial to actually do this over several months and be checking in and doing tune-ups with the teams as they are in the development and implementation process. And we also decided that one of the ways to kind of help facilitate the curriculum was we developed our own PowerPoint and facilitator's guide. And I'll get more into that once I talk about kind of some of the lessons learned. But the facilitator's guide, we used that to help us highlight what was important to each of the jurisdictions and time manage us throughout the day and make sure that we were hitting the goals that each of the jurisdictions had. So we made sure at the beginning, before we trained the local courts, that we understood who they were and what they needed and where they were in the implementation process. And I think that's, again, from the coordinator's perspective, I think that's really important to understand who these teams are and make sure that those needs are met and what they're looking for. In each of the teams, we also encouraged all of the team members, judges, prosecutors, defense, public defender, probation, substance abuse treatment provider, and mental health treatment representatives to attend. We really wanted full teams because it was difficult to make decisions and have discussions about what a mental health court would look like without having the entire team. And we also encouraged the decision makers to be part of this process, and we were fairly successful in that. In several occasions when the decision makers couldn't be present for part or all of the training, that really meant that the team would have to go back and rehash some of the discussion. And so we felt like for efficiency and also to utilize the curriculum, and that we wanted some of the decision makers at the table so that decisions could be made and then we could move on from that planning process. And it was also interesting because we trained teams that were in different parts, kind of on the continuum of developing a mental health court, and 2 of them were exploratory in nature, and one had actually started, as I had mentioned previously, and one had been planning for about 6 months. So they were pretty far into their planning process. In fact, one of the teams was actually very skeptical of even starting a mental health court. And so what we ended up doing for that team is we focused a lot on the research behind mental health courts, what a mental health court is, and then we discussed also what they believed the need was. And that's where I think the data piece comes to be very important when you have teams that are skeptical, or if they just don't know if a mental health court is appropriate for their community. And so having that data beforehand, we would have been able to have looked at that data and then proceeded forward with decision making as well. And just also as an update to the team that was really quite skeptical of mental health courts, they are actually moving forward, and I'm meeting with them tomorrow morning and using the curriculum to work with them on developing the structure of their program. So some of the lessons learned. So first, get to know the team beforehand, as I had mentioned previously, and what they want from the training and specific areas to emphasize. what was nice about doing the training for teams is that you can also use the opportunity to do team building as well. And I think that's really important when you are working with problem-solving courts, is people are all hearing the same information, and it's an opportunity for that team-building process as they're learning. It's, as the state coordinator, I partnered with my colleague who was the state coordinator at the time, Shane Barr. And first of all, I felt like it was advantageous to have two people facilitating and instructing, so we could answer all the questions, we could provide different perspectives, and we could also manage larger teams that way as well. And so, and also come prepared to also be the instructor. We had prepared each of the teams to go through the self-paced modules beforehand, but to be realistic, we also knew that not every team member was going to go through the modules. And so we wanted to be able to plan for that. So that goes back to why we created the PowerPoint. So as we were going through the activity guide, we had the PowerPoint showing that highlighted some of what we felt were the important issues for mental health course in each of the modules, and also what the teams had told us what they wanted to learn and what they wanted to make sure was emphasized through the training. And so that accompanied how we walked through the different activities. And the facilitator's guide was really just a guide for myself and my colleague to keep us on track, to make sure we were managing our time, and also to work through the different activities in the activity guide, as well as if in the self-paced modules, there was a lot of great videos and recordings that if we felt like we wanted to go and show those to the participants, we could quickly find it because we had it in the activity guide, in our facilitator's guide, and pull it up and show the teams that we were training. And the other feedback that we got was we didn't leave enough time for our team discussion, and I think that it was twofold. We did all 8 modules in 2 days, and so leaving we felt rushed in that amount of time, and also we probably cut down team discussion because of that. And so leaving plenty of time for that team discussion, because as I've heard and I think is very true, the product is in the process, and so allowing teams to go through that process of discussion, talking about issues or barriers that they might have or needs that they see, each of the individuals. I think that's really important to allow teams to develop that process while they are developing their mental health course. And prepare for the unprepared. Again, that really goes back to understanding the reality that not everyone is going to come to the table prepared, and also prepare for the unexpected. We, a few days before our training was scheduled, we actually realized that we couldn't stream the videos because of our bandwidth issues. And so we had to go through several different avenues to be approved to stream these videos, and then we also realized that the bandwidth in the course that we were visiting, particularly in the rural areas, it wasn't sufficient to stream the videos. And so we were fortunate enough to get a hold of Alex and their great technical IT people, and so we were able to get the videos in an MP3 format. And so that, I think, was really critical. Otherwise, we never would have been able to show the videos. And so kind of thinking through what is needed during that time, and then making sure that you have the necessary tools to do that. And the other thing is, even when we did have appropriate bandwidth and we had, we were able to stream the videos through our state computers, that sometimes the internet, it would cut out or it wasn't available, and that really does affect the value of the training for the participants as well. And really take advantage of the hybrid learning tools. Going through a full day training is a long time for someone to sit and listen to somebody talk, or even as a group discussion. And so being able to break it up between the videos and the group discussion, and also the small group discussions. And so we worked with the different activities and decided whether it would be appropriate to have it as a larger group or a breakout group. And so, the curriculum allows for so much flexibility to really meet the needs of the people you are training. and that gets my next point, to be flexible. And this was important in each one of the 4 days that we piloted this curriculum with the four different jurisdictions. We actually would have an agenda, and we ended up having to change the agenda several different times because it wasn't meeting the needs of our participants. And so in one case, one jurisdiction was very interested in focusing on target population. That's what they wanted to know. And so we actually ended up skipping over the first couple of modules and focusing a lot of our time on the target population. And so we had to go in prepared, essentially, for all eight modules, understanding where the material could be found if we were asked certain questions. And I'm happy to say we became very intimately involved with this curriculum so that we could go back and forth in between the modules, the activity guides, and also the prep work we found extremely valuable, and in fact would print off some of the key concepts in some of the prep work if we felt like that would aid in our discussion as well with the teams. And so the beauty of this curriculum is it was flexible enough that when we walked in with a set agenda, we could really change it accordingly to meet the needs of the teams that we were training. And so that really wraps up the Colorado experience, and I'm also happy to answer any questions that you might have as well, and I hope that gives you just a brief glimpse at our experience, and I'm certainly also available after this to answer any questions or provide any insight. Thank you.
Thank you so much, Brennedy. So before we start the question and answer session, which just as before I share some of the additional resources for you, just a reminder to write your questions in the chat box on the right-hand side. And before we start answering some of those questions, I really wanted to share some additional information and resources with you. Again, another plug for our survey. I really do mean we want to hear from you, so please take some time if you have 5 minutes to complete our survey. It's there at the bottom of the homepage there where that big arrow is pointing to. Or just send us a message via Contact Us, or also our email addresses will be available at the end of today's presentation. So we do really want to hear from you and what your experience was like using it, or if you have any questions about how to customize it or how to use it. That would be really great. This is what the survey looks like there to give you a preview. We also really would appreciate any photos. We put a call out to our newsletter subscribers when we were developing the curriculum to include photos of courts. And, if you have photos of a group using the curriculum or anything you'd like us to share with others, we'd like to support that and to connect different users with one another. And it's great to see how people are using it. And so please feel free to send us those as well. Some accompanying resources that Danica mentioned actually in the very beginning that BJA supported and the Justice Center created. There's a suite of materials on mental health court relevant for mental health court programs that are available on our website at consensusproject.org. So I'd like to start the question and answer session for our remaining time. And so please just type those into the chat box there, and I'll do my best to answer as many as we can before we conclude at 3:30. So I have a first question here that I'm going to direct to Hallie and Brennedy. I have a question from someone who would like to go through the curriculum with a group, but this group has differing opinions or differing philosophies. So, for example, the mental health staff are very grounded in evidence-based practices, and the judge takes more of a punitive approach. And the person was asking for some advice on how to work with a group like that using the curriculum. Brennedy, do you have experience? Oh, sorry, Hallie.
I have an interesting I did have an interesting situation with one of our teams, and that actually speaks to this. And I don't know if anyone from Colorado is listening, so I'll try to be discreet. But we had a team member that was philosophically didn't align with some of those evidence-based practices on behavior modification and sanctions and incentives, and really responding appropriately to participants' behavior, particularly the population in mental health court. And she didn't show up for the second day of training. And so, so a couple of things. Sometimes you will never be able to change somebody's opinion about those things. And this person retired, and they have created their mental health court, and it's going really well. So I guess, a good answer is not wait for retirement. In our case, it worked out. But, the other part of that is I don't think there is any harm in being repetitious about what those evidence-based practices are. The more someone hears it, I think the more, it becomes part of their, thought, and at least it's something that they maybe will become more curious with. And if we can start planting some of those seeds, and this, then hopefully it can grow to start shifting some of those paradigms of that punitive process versus the treatment process. And so, I guess hang in there and continue to just kind of beat that drum would be my advice.
Yeah, Brennan, I was thinking about a program that we worked with where they said they had been inviting a partner to the table for 9 years, and this year they came. And so there is something in terms of the being patient and being sort of persistent. In terms of sort of reaching if you can call them professional cultural barriers, just in terms of resources that are in the curriculum, the introduction modules talk a little bit about the professional cultures in mental health and substance abuse treatment, the professional cultures for judges, prosecutors, defense attorneys, and sometimes it can be a question of understanding where the other person is coming from and targeting your message appropriately. So we sometimes talk about how judges and attorneys are used to reading memos, and so giving them information in that format that they're used to can be a helpful strategy. But I agree completely with what Brennan is saying, that sometimes it's just a matter of continuing to be polite, persistent, and inviting them to the table, and attitudes don't necessarily change overnight.
Great, thank you both. Our next question is a two-part question. Is the curriculum intended for groups in the planning phase, and would a group ideally go through each module as they plan a program?
I can take that. So the curriculum is designed to include information to help in a team that wants to go through a structured planning process. And so one could proceed from Module 1 to Module 2 to Module 3, and at the end of the 8 modules, you would have covered what is included in starting a mental health court. There are also a lot of different routes through the planning process. And Brennan, I'm not sure if it would make sense for you to share an experience from one of the sites you worked with, but what Brennan was describing in terms of sites wanting to spend more time on certain issues is pretty typical of our experience nationally, where there are certain components that come together to set up a mental health court and operate it, but each different jurisdictions vary in terms of what takes more time, where there's more negotiation involved, the timing involved for getting together the appropriate resources. So there are a lot of paths from the idea that you want to start a mental health court to opening day.
Great. Thank you, Allie. Is there any indication of the benefits or drawbacks of using coordinators or facilitators from inside or from outside a jurisdiction in using the curriculum? Brennan, I don't know if you want to talk about your experience coming into a jurisdiction as a state level trainer.
Sure. I mean, So I can say in Colorado there are certainly times where we're called the state in parentheses, and people can be a bit standoffish, and so I think there could be disadvantages and advantages to having a local coordinator. And just recently, this wasn't part of the pilot, but I have used the curriculum since we piloted it in a jurisdiction where I took a local coordinator that had experience in mental health courts, and he came and trained with me. And so he had some very practical hands-on experience, and then I could provide some expertise with the curriculum and training and facilitation as well. And I felt like we struck a really nice balance there. And so, having some buy-in, getting to know the teams, I think you can hopefully get over that hump of people being skeptical of why you're there. I also was very clear when I was speaking to the teams that we had, we were coming very objectively wanting to provide information, and so we were not coming to tell them to start a mental health court, but if they did, we wanted to give them the best information possible. So I'm not sure if that answers the question, but that's some different perspectives.
That's great, thank you. Next question is someone who is wondering if the curriculum is only for adult programs. How do you have any thoughts on that?
Sure. The curriculum is designed for work with adults. There are only a handful of juvenile mental health courts around in the country, although there are more starting both through federal funding under the Justice and Mental Health Collaboration Program, as well as started under other auspices. Policy Research Associates is doing a survey of juvenile mental health courts, and I know they're working on putting together an updated list of how prevalent they are in the country. I'm not a clinician, and so I'll quickly get myself in trouble about the differences in how behavioral health needs manifest themselves and can be appropriately treated for young people versus for adults. Similarly, in many places, juveniles would not be part of, or young people would not be part of the criminal courts that are typically the process for adult mental health courts. At the same time, there are certain elements that are common considerations in any problem-solving court, whether it is the role of the participants and for young people, their families, bringing together practitioners from different systems, figuring out what happens to the legal case, figuring out how the legal case and the treatment plan interact with each other, identifying local resources that can be leveraged, and similarly the program management and sustainability issues. While the resources might be different for young people, some of the nuts and bolts would be consistent from program to program.
Great, thank you very much. We have a question here about how long it takes to go through the curriculum, which Bernadette, I was thinking about when I read that question, what you said about 2 days not being enough time. If a group wanted to go through the entire curriculum, in your experience, what do you think is an appropriate amount of time?
I would actually, so 2 days wasn't enough through a facilitated process. And so, and I'm not sure what it would be like if a team was actually facilitating themselves through the process. It could go faster or slower. I would actually set it up as, kind of the idea of the communities of practice. And so that are these, 10 modules, and, we're going to meet once a month, once every other month, and kind of go through this, according to kind of what makes the most sense as far as how long you want to plan and when people are available. And so, I think that would be one idea to kind of make sure that you get the most you can out of the curriculum, while also not being a burden on people's schedules as well.
Great. And I also wanted to say for whoever asked that question, and also for the audience, there is some information in the coordinating guide where we provide some sample schedules of different approaches that the pilot sites took and that we heard in structuring the curriculum itself. Great. So we actually are running out of time, and I do apologize if we weren't able to answer all of your questions. We will do our best to answer them in the coming days, maybe through the forum on our website. And, please reach out to us if you have other questions following the presentation. I'm now going to turn it over to Mariana for the closing remarks, but I would like to thank everyone for joining us today, and thank you for your participation.
Thank you, Alex. So this concludes our webinar on developing the mental health court. I would like to thank you all for your attendance and participation, and thank you to the Bureau of Justice Assistance for sponsoring this event as well as the curriculum itself. And I would like to extend a big thank you to our presenters today. They've done a great job in outlining the resource available. I would like to emphasize that a recording of the presentation will be available in the coming days on our website, consensusproject.org. So if you do have any questions about something that maybe a presenter said that you didn't catch, you're going to be able to go back and hear it. And as Alex suggested, if you do have other questions, please feel free to reach out to the presenters themselves. We have a number of questions that went unanswered, and if you feel that it isn't answered through our FAQ section on the website, then please feel free to reach out to us. And finally, when you leave this event, a brief survey on this webinar will pop up on your screen. We would very much appreciate your feedback. Thank you again, and we hope to see you soon.